All right. Good day, everyone. So today is day 7 of the Health Summit of Health and Wellness in the Black community. Today we have Dr. Peterson with us. She's a gynecologist, and she's going to share with us just her experience of what she's noticed in the Black community as far as maybe chronic illnesses or something that needs to have the attention to, and also just give us some tidbits and some suggestions on how we can just improve our overall health and wellness in this particular area. Thank you, Dr. Peterson.
Thank you, y'all, for inviting me. I'm so excited to be on your platform and definitely speaking to the African American community about things that we all can do to increase our awareness and then also improve our health. So definitely a pleasure being here today.
Thank you.
So one of the things that I want to talk about, I feel like we don't hear a lot about this, and it's something I always want to talk about, but nobody really, unfortunately, I hate to say no one cares, but it's just not that popular topic. It's not trending, but it's endometrial cancer or cancer of the uterus. And so this is something that it definitely affects women of all races, but it affects African-American women probably a little bit more when it comes to the death rates. Our death rates are slightly higher in the African-American community when it comes to uterine cancer or endometrial cancer as opposed to other races. Just to give you a little background, a little bit of statistics, and actually let me start from the beginning just to make sure people know where this cancer is located in the body. So endometrial cancer or uterine cancer is, of course, in the uterus or in the womb of a woman. So this is something that's particular for women, and it's not something that you would see in men, of course. And endometrial cancer, in 2018, about 58,000 women were diagnosed with this cancer, and over 11,000 women died from this cancer itself. So it is one of the top 10 cancers that are found in women. And when we look at the number of deaths, is actually in that top 5 group. So when we're looking at breast cancer, lung cancer, what else? Colon cancer, pancreatic cancer, it's number 5. It's right up there, but we don't hear a lot about it for some reason or another. It is more common in women who are older. So the average age is actually 63. So this is something that tends to be diagnosed in those postmenopausal years. And one of the things that a lot of my patients will present with, unfortunately, I see a lot of these women come to the emergency room and they say to me, well, I'm on my period. And I'm like, well, what do you mean exactly? Because these women are in their 60s or their late 50s. And I know, I guess as a professional, once you're in your 60s, it's not normal for you to have a period. It's not normal for you to have bleeding. So anytime a woman has stopped having a period consistently for a year, and she's in that 50 to 60 age range, or really the 50s, once your period has stopped for a year, if you have any bleeding after that, that is abnormal, because once you've not had a period for a year, you're considered to be postmenopausal. And so after that point, there should be no more periods, there should be no more bleeding. And if you do have any bleeding after that, that's a sign that there's something going wrong. So that is not a normal period. Your doctor will not say, oh, your period came back. No, if you're in your 60s, your period does not come back. And I think it sometimes gets confusing because sometimes these women are on blood thinners, or maybe they have other health conditions, maybe they have hemorrhoids, and sometimes those bleed. And so they're not really sure what's going on. Is it because of a medication, or if it's because of hemorrhoids or something else? And so they kind of ignore it, but it's nothing to be ignored. It's not necessarily something you have to come to the emergency room for, but it is something that you need to be examined for, or it needs to be checked out with your doctor as soon as possible. Now, so there's actually 2 different types of endometrial cancer. There's type 1, which is more common. Usually when it's diagnosed, it's still confined to the uterus, and a simple, I shouldn't say simple, but a hysterectomy would be basically your treatment, and you may not need any further treatment. Type 2 endometrial cancer is a little bit more advanced and staged when it's diagnosed, and it is a higher grade, which sometimes means that the treatment may be more than just a hysterectomy. You may need chemotherapy, radiation therapy, and things of that nature. And unfortunately, that type is more common in African-American women. So there's something that we need to know. We need to keep it in the back of our minds so that when we do see those symptoms of maybe bleeding in the postmenopausal years, we notify the doctor right away.
And what are some ways that we can go about, especially women in the African-American community, can go about to get tested for this, especially, generally annually, women generally go for their annual physical or what have you, see their gynecologist. Is there a specific testing that the doctor can do, or is it something that we need to bring up?
Right, so that's a good question. Unfortunately, this is one of those things where there's no screening test. Okay, so just kind of like pancreatic cancer, there's no screening test. Ovarian cancer, there's no screening test. And so, and it's not something that you would bring up unless you knew that you had a genetic syndrome that predisposes you to uterine cancer, or if there's a family history of it.
And when you say predisposed, so what if someone had breast cancer?
Right. So breast cancer is not necessarily linked to this cancer. Okay. It is linked to something that's called Lynch syndrome, which is actually connected to colon cancer. And so if people who are diagnosed with colon cancer at young ages, they may be tested for Lynch syndrome. And if you receive that diagnosis, then you should also be mindful that it's linked to uterine cancer as well as ovarian cancer.
And you said there is no screening, and I'm sorry, go ahead.
Right, so there's no screening test. So that's why we just have to be really cognizant of that postmenopausal bleeding as one sign to not sit at home when that happens, to go ahead and make a doctor's appointment right away.
Okay, very good, very good. Wow, that was definitely very eye-opening, because this is very important, especially I know quite a few people who are in that stage of life of menopausal post, and this is really, really important, and this is really good to know. That kind of shook me up a bit there too. So I was like, wow. Okay, very good. Okay, second time scared straight during this health and wellness summit. Wow. Is there anything else?
There's quite a bit else, quite a bit more, but I will say one thing that young women should be mindful of are those irregular periods. And so things like PCOS syndrome, or if you've heard the term anovulation, which just means you are not ovulating, those two things will cause you to miss periods. Now, and if you miss your period chronically, so over years, that actually increases your risk for endometrial cancer. Now, so I'm not meaning, when I say you miss your period, I don't mean that maybe 1 month your period is on the 1st and then the next month is on the 5th. That's not what I mean. There are some women who will not have their period for 3 months at a time, 5 months at a time, 6 months at a time. And this happens for them every year. This is just, for them, it's become normal. They know it's not normal, but they don't know what's causing it. And so sometimes we miss our period because of medications we're taking, and that's completely different. That's not what we're talking about. We know that there are certain birth control medications. There are other medications that help with also GYN related, but they help with women who are having bleeding all the time. So we can put them on certain medications to kind of stop that bleeding. So these women are excluded from this risk. But if you are not taking any medications, you have not been treated with chemotherapy or radiation therapy, which could cause you to start missing your periods. If that's not the case and you are missing your period, then you as a young woman could also be diagnosed with uterine cancer.
Okay.
Yeah, don't sit home for 5 or 6 years, skipping your period every year for 5 and 6 months at a time.
Wow, that is really, really good to know. Wow, okay. So let me ask you this, maybe on a lighter note.
That's pretty heavy.
So for women, for women in general, is there anything, because generally we usually have our general annual appointment. Is there anything that we need to specifically ask the doctor for that maybe we missed? We know generally, the pap smear, the STD and everything like that, those kind of panels. Is there anything that you would suggest or recommend that, we should get screened for, or any other testing?
No, so, definitely have that pap smear. So that's going to rule out your cervical cancer. But for this uterine cancer, there's nothing else. So we put high risk for women who have diabetes and high blood pressure and obesity. So just that whole lifestyle modification thing is something that you want to discuss with your doctor. If you are overweight, ask the doctor, what is my BMI? What should it be? What things can I do to lower my weight? Of course, if you smoke cigarettes, that increases your risk for type 2 endometrial cancer. So discussing a smoking cessation with your doctor is something that you can discuss. But there's nothing that would directly lead to this diagnosis. Unfortunately, it's something that's kind of diagnosed after the fact.
Wow. Oh, okay. Well, thank you, Dr. Peterson, so much for being a part of today. So appreciated. So there you have it. As women, our bodies can be so complicated at times, but, as Dr. Peterson said, if there's anything that seems out of the normal, go see your doctor, because if there's a way that we can at least catch something in its early stages and able to do something about it, let's go ahead and do that. No need to wait, no need to be ashamed or embarrassed or anything like that. Please see your doctor and just share where you're at and what's going on in your world, especially as a woman, especially as someone who is, in the stage of menopausal, or even prior to, just pretty much any all stages of your life as a woman. That is extremely important, because again, if we can catch something, and as she, Dr. Peterson just mentioned, unfortunately there is, there's no screening for, certain types of cancers that she had mentioned with the uterine cancer. So we want to make sure that we're diligent about getting those exams, that we're, just being really proactive with our health, and that, yes, life can get busy. Yes, we are caretakers, but the first line of defense of taking care of anyone is yourself. So please, please, please be sure to, see your doctor if there's anything that's even just a bit of a concern. Don't just brush it off, but make that appointment.
Right. And with probably everything that you discussed this week, just maintaining that healthy lifestyle, exercise, eating healthy, that is basically the key to truly reducing your risk for so many others.
Yes, absolutely. Thank you so much, Dr. Peterson. We really, really do enjoy having you today. You can find her information in the description. Please, 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 again, make sure you're making those appointments, and please be very, very, very proactive in your health.
Thanks for having me.